Next, on the white blood cell count, which is done to monitor the infection issue, the normal total white blood cell count, the normal hemoglobin count, and also the normal platelet is as stated. Next, patient shall be checked on the symptomatic improvement such as from his vital signs, hemodynamic stability, Glasgow coma state, and also alertness level for this patient. For the short-term therapy plan, firstly, we will need to overcome developed redness around the area of the chest and the neck, the low blood pressure and fever. We will need to withhold the dose until the symptom disappear. Then we will continue with vancomycin regimen with appropriate administration rate which is below 15 mg per minute. Next plan will include to give patient fluid management to reduce the sodium value in managing hypernatremia. However, make sure to always monitor the sodium level because if too much fluid can lead to hyponatremia. Other than that, monitoring of input and output chart of the patient is also important so that we can manage the fluid in the patient body and detect whether there is a risk of water retention. The next plan is to overcome the high respiratory rate. Monitor the arterial blood pH so that it does not fall below the lower limit because it can cause metabolic acidosis if it reduces even further. Other than that, monitor the respiratory rate of the patient because a higher respiratory rate is a symptom of metabolic acidosis. Lastly, the plan is to overcome the unavailable data of the full blood count test. We will need to conduct the full blood count to check the level of white blood cells to determine whether the infection has resolved or not. Other than that, is to conduct the culture and sensitivity test once again to check the presence of bacteria.